we have known that ApoE4 affects the metabolism of omega-3s for a while. I mean, our lab has been looking at that for several years now. We've identified an enzyme known as calcium-dependent phospholipase A2. We call it CPLA2. And in our animal models, when we inhibit this enzyme, we actually increase the amount of omega-3s in the brain, meaning that understanding what defines or what determines the levels of omega-3s in the brain might be quite important. If it's not your diet, it is possibly that the brain is breaking it up in conditions like Alzheimer's. And by understanding the pathway and making drugs to inhibit the loss of omega-3s in the brain, we might be able to keep those omega-3s where they're supposed to be and help them work so that we can decrease the risk of dementia. So I think our research is heading toward more mechanisms of how omega-3s are being metabolized, how they get into the brain, how are they broken down, and particularly in ApoE4, what pathways are altering their metabolism, and can they be druggable so we can develop a medication that allows the brain to use them better. On another front, we have also developed a probe that images the omega-3 brain uptake. And this is a novel PET scan-based probe where you have an 18F signal attached to that omega-3 DHA. It's injected into mice. So we've done these studies on mice and captured the uptake in the brain. So we want to move that into clinical trials and into the human population, where we can actually, in somebody who, is maybe 30 years old or 50 years old, understand, is their brain taking up enough omega-3s? What determines that uptake? Can we change it and potentially prevent dementia way before any signs of dementia develop? So we're excited to continue understanding the pathway, the metabolism, in humans, and lead to more effective therapies.